Hello, everyone. Yeah, I'm actually quite excited to share with you all. And also, I realized that I'm in between you guys and Lucky Draw, so I guess y'all will stay awake for my talk, because y'all are excited to win something today, right? Yeah, so I'm going to share on overcoming emotional fatigue. Okay, at times while we are in the journey of dealing with the diagnosis of perhaps you or your loved ones with myeloma condition, we may find ourselves emotionally tired, and that is actually very normal. So what is emotional fatigue? It is a state of feeling emotionally worn out and drained as a result of accumulated stress from your personal or work life or combination of both. Emotional exhaustion is actually one of the signs of burnout. There's also a feeling of having no power or control over what is happening in your life. Sometimes you may feel stuck or trapped in a situation. And at times, emotional fatigue also means you have that lack of energy, lack of sleep, and also decreased motivation. As you see from the stress curve here, picture is a bit small, but as you see from the stress curve, when we actually overload ourselves, we may feel exhausted and our daily productivity would decrease. Sometimes there will be physical symptoms like anxiety or panic that may surface. I thought I would introduce my patient to you so we can actually journey through the following slides. So let me introduce Madam M to help us better appreciate this topic. Madam M is a 57-year-old lady. She's married with a daughter who is studying in tertiary education. Her husband is the sole breadwinner of the family, and when she was diagnosed with multiple myeloma, it actually affected her mobility. And just now I mentioned about bone fracture, back pain, so she did experience that. When I first got to know Madam M, she stayed in the hospital for about 2 weeks. Her first week was at Khoo Teck Puat Hospital, and then following that, she was transferred to Tan Tock Seng Hospital. And it was a long hospitalization for her because she had not stayed in hospital before. And she had to go through many different tests, investigations, dental checkups, so on and so forth to actually confirm her diagnosis. As Madam M was not fluent in English, she did not understand most of what the doctors were saying. She felt a loss of control of her situation, and this created a barrier in her to try to understand actually what's the doctor trying to tell her. She could not make decisions because her mind was just too cluttered. At this point in time, I just want to check in with the audience here. May I have a show of hands? How many of you, when you had felt the same way as Madam M, that your mind, was cluttered when you were first diagnosed? Anyone? Yeah, I see a few hands there. Yeah, so it might be a common feeling, you just can't hear much of what the doctor is actually saying. So what causes fatigue? Some causes of fatigue may include having to make decisions of your treatment options. It could be financial, like just now what Dr. Darryl mentioned, like the different treatment, the different costs, and you need to weigh the costs involved, and there may be treatment A, treatment B, treatment C, and having to decide actually which treatment best suitable for you. Yeah. Sometimes causes of fatigue might be also having this clutter, a prolonged stress manifesting into brain fatigue, or overcommitting, having continuous cognitive load. So for example, the doctors tell you something, the physiotherapist tell you something, the occupational therapist tell you something, the dietitian tell you something, and everyone tells you something in a day. So that could be too much information that leads to cognitive load, and it may just lead to a full-blown burnout if it happens over a period of time. So when we procrastinate or avoid, our anxiety about whatever we are avoiding tends to increase. And this in turn depletes your mental energy. And just now as mentioned, lack of sleep also may be a cause of fatigue. So we should have 7 to 9 hours of sleep, so lack of sleep may cause fatigue as well. Medication, pill burden might also cause fatigue, and other emotionally challenging experiences. For example, being on treatment all the time, or the pain or the constant symptoms that you're having from the treatment. Back to Madam M. So for Madam M, she actually blanked out and she cannot retain information. It was not an easy journey for her, as during the same period, her father, whom she was close to, also passed away during the same period of time. So it was an emotionally challenging experience for her. There was also financial impact because her husband needed to work to provide for the family. But he also needed to be there for Madam M, who had also experienced loss of functions temporarily. At this point, I also want to share that, sometimes when we look at a person and we talk about loss of functions, there might be other things underlying. So for example, Madam M, considering that she's in her 50s, she might have loss of health, loss of functions, but underlying it, she might be worried about loss of future. Will I be there when my daughter grows up? Will I be able to see my daughter graduate, get married? So those are some of the uncertainties that she was also facing. And the family also had to decide on hiring a helper because the husband was already taking 2 months of unpaid leave, and he needed to get the family running as well. Some other symptoms of emotional fatigue includes the following: physical, insomnia, can't sleep at night, thinking about too much things, the mind is too cluttered. Physical fatigue, sometimes not doing much but still feeling very tired. Absent-mindedness, like just now what was mentioned of having the chemo brain, forgetting things, having headaches, and change in appetite. Probably might have some food anxiety as well, what to eat and what not to eat. Yeah. Emotions. Emotions include feelings of hopelessness, not sure what the future will look like, not sure will I ever get better, will I continue this treatment for how long, will there be a relapse? So all these feelings might be easily irritated, easily triggered by small things, or feeling depressed. Some of the thoughts which are the symptoms of emotional fatigue can include lack of motivation, perhaps not wanting to make decisions, having difficulty concentrating, or sense of dread. Some of the behavioral symptoms could include apathy. Sometimes when you notice a patient your loved ones are not really caring about what treatment options to make, what decisions to make, it might be an emotional fatigue that they're tired of deciding. Nervousness, irrational anger, and increased pessimism, just saying that, nothing will work, just let me die, nothing will work. Yeah, so we do get that sometimes, and we want to provide that emotional space, a safe space for the patient to actually share how they're really feeling about all this that's going on. Okay, at this point, I also want to highlight the emotional warning signs that perhaps you as a patient, a caregiver, or healthcare professional can keep a lookout for. The first one, is the patient able to make meaning of the illness? Second question, does the patient have the will to live? Third question, is the patient socially connected? Fourth question, is the patient able to function normally? For example, waking up and getting dressed, going, having breakfast, or going to work, or totally not able to do that anymore. If any of these questions is a no or a question mark, I'd like to suggest you can get this patient to actually speak to a professional or trusted friend. Back to Madam M. So for Madam M, her treatment was bortezomib, and we also applied medication assistance fund subsidy for her daratumumab and thalidomide. So she eventually went over to SGH for her autologous transplant. Her treatment journey was actually very difficult, and she felt weak and unwell. There was also feelings of helplessness. So some of the symptoms of emotional fatigue for her included being tired, having lack of appetite, so I saw her lose weight. I saw her first time was when during her long hospitalization. After that, subsequently, I met her at the clinic and I noticed that she really became quite skinny. She was also unable to focus. Yeah, so I can talk to her about other things, about her family, about her daughter, about other things. But when we talked to her about her treatment and things like that, she was unable to really focus very much. And I also heard from her husband that she was easily triggered. She'll cry sometimes in the middle of the night, and he had to be there for her. So while engaging with her, I also had that 4 questions that we had in the previous slide on my mind of the emotional warning signs, and that I went through and just to assess how she was emotionally. So for Madam M, definitely she has the will to live because she wanted to see her daughter grow up and get married, but she had difficulties in making meaning of her illness. She asked, why me? Why now? You know, I'm 57, I have a good job. My daughter is already in polytechnic. We are almost to, you know, me and my husband, almost to the empty nest, right? When we see our kids grow up, and why does this have to happen now? And she also stopped socializing with friends and she couldn't sleep well. So for her case, I actually had to meet her, I think, for the period of 1 year before she was transferred to SGH for the transplant. Yeah, so to just journey with her, meet her during her clinic appointments, yeah, just to ensure that she is okay. And she has a safe space for her to share how she was feeling. So how do we overcome fatigue? I think today I'm very privileged because all the speakers have shared a bit here and there already, so I just summarize. So how to overcome fatigue? Make lifestyle changes and really physically moving about as much as you can. Your body will tell you when to stop. If you really feel it's too strained already, that's time to stop. And this actually helps to reduce the fatigue, physical fatigue. Okay, having a balanced diet, eating healthily and limiting alcohol intake, rest more. Yeah, so just now was mentioned also to have a good sleeping hygiene that really helps. Practice mindfulness, okay? Mindfulness, this one I'll share a little bit more in my later slide. What does practicing mindfulness means? This is a buzz topic, right? Everyone talks about mindfulness. So for example, have a daily gratitude journal. You know, we want to start small. You may have big dreams, future goals, but we want to start small. What are you thankful for today? Something small, being able to talk to my loved ones, not having that nauseous side effects. That's something to be thankful for that day. Yeah? And turn off distractions. Be present. Notice your surroundings. Acknowledge stressful thoughts and letting them go. Saying yes to self-acceptance and self-care, connecting with a friend, and spacing out household chores that your body can manage. So for example, for Madam M, she used to do all her household chores alone. Yeah, so she actually changed it to probably in the morning, she just clean the kitchen and the living room, then maybe towards the evening, then she does the rest of the household chores. So that worked for her. Yeah. So for Madam M, she had her sister and her husband as a form of emotional support. Her husband would always help to make medical decisions in her best interest. And because us as healthcare workers, we do observe that close relationship, we know that the husband knows her very well and will decide in her best interest. So in this way, it helped to take away the burden from Madam M. Madam M, thankfully, she also had insurance coverage. So most of her chemotherapy bills was covered. However, she did not have cash upfront, yeah, to pay for her outpatient appointments. So we assessed and also reviewed that she qualify for Medifund, so we applied for Medifund to help her with her medical bills. She was also referred to our support group, like the support group that Peter mentioned just now. Yeah, so there's Jessica, there's Liling, there's Peter, and there's quite a number of others. So we reached out to them. And thankfully, during that time, actually volunteers couldn't come to Tan Tock Seng. Right, they stopped all volunteering activities. So we had to think of how to still connect them, because at this point, they are at their lowest. They would want to hear from someone to journey together with them. So there was this WhatsApp group. Yeah, so I reached out and I asked anyone who is able to reach out to Madam M. She speaks Chinese and she's available at this and this time. So thankfully, yes, there was a survivor who reached out to her, and that helped her, to just journey with her during that period. It provided comfort and support and assurance to her during her cancer journey. Yeah. So, yes, this is bubble tea. So, mindful practice. While practicing mindfulness, it's important that we turn off distractions, focus on the present, acknowledge stressful thoughts, and let it go. So I want to illustrate from this analogy of bubble tea. Anyone of y'all drink bubble tea? I hope I'm not the only one. Anyone drink bubble tea? Yes, thank you. The dietitian also drink bubble tea. You can drink bubble tea sometimes. You need to distress, right? Okay, so I want to use this analogy because to help us understand how to self-care, how to be mindful. Okay, what are the ingredients in bubble tea? 3 things. I make it very simple. You need ice, because you want the cold bubble tea on the hot day in Singapore. You need pearls, okay, and you need tea, right? Ice, pearls, and tea. There are a lot of additional toppings that, bubble tea shops like Koi, Liho, they will always offer. They offer, okay, you can add fruit so that it be healthy, you can have jelly, you can have other things, so for the extra flavors. Okay, so how does this translate into practicing mindfulness? Imagine our lives. We need 3 things. Ice, pearls, tea. 3 things. So these represent the people who are important to us, those things which are important to us, and there also needs to be space for self-care. So you go to a bubble tea shop, they will just shake, right? They shake it and you can hear the sound because there's still some space inside, for them to shake. So we need to be able to handle these 3 ingredients first and have the space before we add on any additional toppings. If we cannot handle, then these additional toppings may just overflow. Okay? At this point, I'd like to have some audience participation. I'd like you to take a minute, okay, to share how do you practice self-care. Okay, both online and also in the audience. Can I go to the Mentimeter? Yes. Can I see the top screen for the code? Okay, you can go on to, yes, thank you, www.menti.com. Key in the code 19291363. This is not lucky draw. Go to www.menti.com. Yeah, then use the code here 19291363. Both on-site and online, you can participate in this. I just want to get an understanding, how do you self-care? What are the activities that you do when you are emotionally tired? It helps you to really rest. Let's see what response comes in. Sleep. If you notice, if the word is the biggest, means everyone says that same thing. So we'll see whether sleep continues to be in the center. Karaoke, talking, or facial, yes, important. Exercise. The word today, meditate, relax, spend time with loved ones, watch a movie, do baking. Do you all notice? Sleep is still in the center. Thank you all for the response. Yes, so as we can tell from here, sleep really helps, right? You sleep away and then you kind of rest your body also. Yeah, so that really helps. Okay, there's this burnout rating scale that I'd like to share with y'all. Y'all can take a photo, or if you're online, y'all can screenshot this. It's 2 pages. I'll just leave the first page on for now. Yes, so this is a skill that you can use to check in on your current state, or your loved one's current state, or your patient's current state. Okay, so it asks questions about, do you feel fatigued in a way that, sleep does not relieve? Is your memory unreliable? Are you irritable, emotional, with a short fuse? Okay, the second page. Do you feel like isolating yourself from your colleagues or friends or family? Do you feel that you are accomplishing less in your work? So you can do that as your own mindful practice, just being with yourself and, understanding how you're really feeling. Yeah, so the score is as follows. So if you are on the scale of probably 36 to 50, may I suggest you speak to a friend or a professional? Yeah, so you may be having high burnout rate. These are some other resources that may be relevant to you. Most importantly is really to be self-aware, self-care, and reach out. You can take a picture of this as well, or a screenshot. Yep, so I hope that the next time we can see you at the MM support group. Yeah, go for the walk and connect with friends and like-minded friends. And thank you so much for your attention. And remember, instead of IPPT, I'll give you IPTT. Ice, pearls, tea, then toppings. That will help you. Thank you.